How's it going, guys? It is 12:23 a.m., 8th of December here in Japan, and we have a pass level question for step one and step two. Okay, some of you will see this clip and be like, okay, that's too easy. I know these values, these arrows already. Okay, well, many of you fucked them up. So we're just doing a quick review here. Doesn't need to be fancy or dramatic, this question. Okay, just gonna tell you the arrows and then not waste our fucking time. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical. mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel are down below. Now start the clip. So 39-year-old woman. She has a newborn male who has flat facies, slanted palpable fissures, a single palmar crease. X-ray of the abdomen shows a double bubble sign. And then they want to know what was most likely to be seen during pregnancy via the combination of her tri-screen, quad screen. So this is obviously Down syndrome, trisomy 21. Okay, we're handing you the diagnosis. We're not trying to make this hard. And you say, well, what's going on with the X-ray of the abdomen? Well, you need to know that this is buzzy. Double bubble sign is buzzy for duodenal atresia, which can be seen in Down syndrome. Okay, so duodenal atresia, Hirschsprung disease, also high yield for Down syndrome. So what are we going to see during pregnancy? So we have pregnancy-associated plasma protein A. It's part of the tri-screen in first trimester. And you need to know that this is down. Okay, so students will remember that it's abnormal, but then they forget the direction. It's down. Okay, not hard. We're just regurgitating directions here. So we're looking at only these bottom answers. So now we say, well, what about AFP, beta HCG, estriol, inhibin A? I'm going to tell you a very easy way to remember these, all right? There's two ways you can remember. The first is the ones that have the H's are increased. So inhibin A, we know has to be up because that has an H in it, inhibin, right? Beta HCG has to be up because that has an H in it, right? All the others don't have H's, so we know that they're down. So the answer here is decreased PAPA A, decreased AFP, increased HC, beta HCG, decreased estriol, and increased inhibin A. So the ones that have the H's are the ones that are up. Very fucking simple. The other way to remember it is in the quad screen, which is these latter four. If you go in alphabetical order, AFP, beta HCG, estriol, inhibin A, it's just down, up, down, up. Okay, so AFP, obviously that's going to be high in neural tube defects, as well as anencephaly, gastroschisis, symphalocele, multiple gestation pregnancy, okay? It would be increased in that case, but it's down in Down syndrome. Estriol is a marker of fetal well-being. So if you say, well, it's obviously not good, it's not ideal for a kid to have Down syndrome, that's not well-being, quote unquote, so that's why estriol is down. Okay, so you're also going to get something called increased nuchal translucency in first trimester screen, okay, for Down syndrome. For Edwards syndrome, you're going to have decreased for the entire quad screen. They're not going to ask you about PAPA A. Not a long question here. Very fucking simple. That's the point of these clips here. Not wasting our time, right? You know the deal. To make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.